There's a new study published in JAMA Internal Medicine, and they found that in the 13 states where medical marijuana is legal, there were fewer annual opioid overdoses. So in other words, we're talking about the pills here. I'm not sure exactly the difference between opioid and opiate, but I know that, they're basically the same or derivatives of the same thing, where we're talking about, Vicodin, Percocet, oxycodone, OxyContin, you name it. Those are all slightly different variations of the same thing, whether it's hydrocodone or oxycodone. They're painkillers of the opiate class, okay, which, again, is related to morphine or heroin or the poppy plant, right? So they say, quote, deaths were nearly 20% lower in the first year after a state legalized medical marijuana and 33.7% lower 5 years later. They say overall there was a drop in opioid overdoses by 24.8%. That's impressive. Now, they don't go on to say what the actual drop was in just opioid pill usage. I'm curious to see how much that dropped. And here's where it gets really interesting. They say, quote, the researchers examined whether drug monitoring programs or patient ID requirements had reduced painkiller abuse in states with legalized medical marijuana, but found no significant connection. So, in other words, here's what that means. It really looks like some people just picked marijuana over Vicodin or oxycodone when they had the option, okay, and it's working. It's saving lives. Isn't that amazing, man? See, for so long, we've repressed this plant, this drug, which has so many positive uses, okay? Whether it's medicinal, whether it's recreational, you name it. I mean, people historically have used this because it works, essentially, right? And finally, we're getting a little taste of what happens when you mainstream the drug of marijuana, and the results are overwhelmingly positive. You're taking a drug which can lead to overdoses more often, okay, and you're saying, well, this has a lot of similar properties and a lot of pain-killing effects in and of itself. So if you give people the option and some more pick marijuana and then less overdose, well, that's a win all around, isn't it? And look, the unfortunate reality is, I don't know why, but the pharmaceutical companies haven't caught on to the fact that they can get in on this marijuana stuff and make money off that too. Instead, they're just defending their older products. And once they catch on that they too should make money off the marijuana and they too should get in on that game, then I think it's going to be much easier and you're going to see the states fall even faster in terms of not just medical legalization, but actual recreational legalization, okay? And the problem is you have the medical lobbies blocking it today. You have the alcohol companies. They view marijuana as competition. They're blocking it today. The tobacco companies, same thing. They're blocking marijuana today. The DEA, a lot of people don't know about this. Government agencies that make money off of drugs being illegal, they are lobbying to keep drugs illegal. So we have this massive lobby or lobbies fighting to keep this drug illegal when we have the evidence that shows that this is a drug that you can overdose from. It's not physically addictive, okay? You could say it's psychologically addictive, but what that even means specifically is a little bit up in the air, right? It's a drug that's not as hard as any of the opiates, okay? And it's decreasing deaths, but we're still not saying nationwide legalize it for medicinal use, or I'd go further and legalize it for recreational use. And it's a fucking problem because all the evidence is pointing to the same conclusion, but we're ignoring it, okay? And understand something, man. This is coming from a guy right here. I like opiates a lot more than I like marijuana. So you want to talk about a guy who is biased in the other direction? I'm as biased as it gets in the other direction, okay? But facts are facts. Reality is reality. 24.8% drop in opioid overdoses in the states that legalize marijuana for medicinal use. I bet that number is even higher when they legalize it for recreational use because it's even more readily available, okay? And this is the answer, man. This is the answer. And even if you reject everything, all these nuanced arguments that I'm giving you and the information I'm giving you, how about just this for an argument? Freedom. How about you should be able to put in your body whatever you want to put in your body as long as you're not hurting anybody else. And if you disagree with that, that's fine, but you're admitting you are anti-freedom, okay? You don't want people to make their own choices. You want to be the nanny state, big government with the negative connotation that says, hey, what do you put in your body? You're not allowed to do that because I say so. Now, in some cases, big government makes sense. This is not one of them, okay? So let's be more rational here. Let's be more open-minded, and let's do what we know is right in terms of drug policy.